Thanks for joining in. I want to talk today regarding managing and avoiding shoulder pain. There's some times that we want to push, pull, lift, or carry, and we have a hard time doing it because our shoulder hurts. And so I want to go over some ways that you could move or exercises that you could do to help avoid and manage shoulder pain. First I want to give you a story. A couple months ago, I was resisting a strong downward force, so I was pushing up with both arms. And I only did it repetitively for about maybe 2 minutes. But the next day my shoulder was so sore. I didn't feel the pain during the time I was resisting the force, but the next day my shoulder hurt really bad. And it continued to hurt for several days. But I will give you some tips of things that I did to make sure that that shoulder pain didn't become chronic. The things I will show you today also would help somebody who does have chronic shoulder pain to reduce stress to the shoulder. So when I was lifting that strong upward force, my shoulder blades were kind of going up, and they shouldn't have been as much as they were. And also I was putting pressure on the space between my shoulder and its socket. So the shoulder's a ball and socket joint. And in that space, there's a bursa, it's a fluid-filled sac. There's tendons, like the long head of your biceps, and some rotator cuff tendons that wrap around. So in that space, if those tissues in between the ball and the socket, they'll get compressed or irritated. They can give a lot of shoulder pain. So I want to go over some things that you could do to help reduce that stress, particularly in a flare-up or if you're having chronic shoulder pain. So the first one I would suggest to do, when I had that shoulder pain, I was sure when I was going to go to lift something, my shoulder blades weren't up and forward as I went to go lift something. So I was being sure to keep my shoulder blades back and my shoulder blades down as I was lifting up. That gave me less shoulder pain.